So hi, everyone. I want to welcome Dr. Jen Lincoln. She's a board-certified OBGYN and international board-certified lactation consultant. She practices in Portland, Oregon. Thank you so much for being here, Jen.
Yeah, no, thanks for having me. This is awesome.
Yeah, of course. I'm really excited to talk about what we're talking about today. So before we get into the actual topic, can you tell everyone sort of what brought you into being an OBGYN and also your lactation training?
Yeah. So I was one of those kids growing up. I always wanted to be a doctor, although I never quite knew what. And then I did my rotations. I went to Tulane University School of Medicine in New Orleans, and I was there during Hurricane Katrina. And so most of my third year rotations I actually did in Houston when we were evacuated there. And I did my OBGYN rotation at Ben Taub Hospital, which is a community hospital with lots of babies being born. And as a medical student, I got to do so many deliveries, which would not have happened had I been at my home institution. So it's kind of like, it's a nice benefit with all the craziness that we've gone through.
Right.
And I loved it. And I loved not just doing the deliveries, which is what everyone thinks of when they think of OBGYNs, but I love the ability there's so much advocacy work, speaking up for women's health. You are there in these intimate moments. You have a chance to really change a woman's life. And just give her the care that she deserves. And then you do get to do fun stuff like help people have babies. And in terms of the breastfeeding stuff, it was when I had my oldest, he's now, oh my gosh, he's 9.5. I had my chief year of residency and I was breastfeeding, and I realized at that time how poorly I had been educated in breastfeeding. And I think that's changing, but we still do not teach our doctors in training enough. And so I pursued additional training after that. And I'm so glad I did. So.
Yeah, no, I think lactation is a super fascinating field. As you know, I have a 7-week-old at home. And so I am completely fascinated by the whole concept of it.
Yeah.
And even though I knew about it, I'm still amazed when I look down and I'm like, whoa, like there's milk coming out of my body. It's crazy.
It's crazy. And you can go down the rabbit hole of like the chemistry of breast milk and the physiology. And when you're a physician, that's the stuff that gets you going. And you just realize there's just so much to learn. And it's another public health thing, just like with women's health. It's not just in the office. It's how do we support women if they choose to breastfeed, how we can best do that. And we're not so great at it in the country. We're getting better. But we as physicians, we need to be advocates for women. So.
Agree. And, it kind of brings me to the topic that we're going to talk about is telemedicine. And so I actually, in the middle of COVID, had a virtual lactation consultant to help me because my son wouldn't latch. And unfortunately, he still hasn't. But it was really nice to be able to have that option and be able to see someone virtually, because I thought that, how would they even be able to help me because they're not there? But, between me and my husband, who was able to hold the camera, we were actually able to do a lactation visit, and I got a lot of good tips and just some tricks to use and try. And that was really, really helpful and comforting to just even talk to someone about what I was going through and sort of know that it was okay that he wasn't latching and, just sort of how to troubleshoot and move on to the next step. So what can we do via telemedicine from an OBGYN's perspective? Like, what do you think we should do that would be appropriate via telemedicine? If you can just start off and let us know, a few things that you as a doctor feel comfortable with your patients seeking virtual care for.
Yeah. So I think if we want to talk about one silver lining of COVID is that telemedicine got pushed to the forefront. And I'm probably speaking to the choir here, but so much of what we're doing now, we should have been doing many years ago because we've had the technical capability to do it. And historically, we as physicians haven't because insurance companies have not reimbursed for it. So, and that might sound kind of cold, but it's hard to keep your practice doors open if you're not getting reimbursed for what you're doing. So now the insurance companies have stepped up, and I'm hoping that they realize there's a demand and that if they try to take away telemedicine coverage, patients speak up. So much of what, I think that it only makes sense that we're doing this because there is so much. And if we were just talking about women's health, I can think of so many things that are appropriate for a telemedicine visit. And you think about the basic things that we counsel so many women for, it doesn't really require an office visit. So let's talk about contraceptive counseling, going through your birth control options, menopausal medicine, talking about, issues with menopause, hormone replacement therapy, even prenatal care to a degree can absolutely fit in the telemedicine space. And that's the one I'm most excited about, because when we think about how prenatal care is delivered in this country versus other countries like in the UK, here in the United States, we have a lot more in-person visits. And it's not to say that I don't want to see my patients in the office. It's just, do they need the number of visits they have? And we have lots of papers and studies about this. You know, does bringing people in more translate to better pregnancy outcomes? Or is it just bringing them in at the right times and supplementing it either through group prenatal care or virtual prenatal care at other times? And I compare it to Europe because they've got, you know, they do fewer visits and their outcomes aren't that different. And I think about, you know, when you're pregnant with your first, maybe you've got more time to go in, but if you're on your second, your third, your fourth kid, I've seen so many women who just barely come to their visits because they don't have somebody who's going to care for their other children, or they can't, you know, anyone, we talk about access to care. They can't afford to be able to take off from work because of course our visit hours are terrible, right? They're business hours during the week when everybody else is working.
Right.
Or we think about restrictions in, you know, we call these women's healthcare deserts where there's not an OBGYN office within 50 miles and those offices have closed because of malpractice. So why, and everything else that we can do, you know, we can Zoom call, we can FaceTime, we can do all these things. Like, why would we not integrate that in medical care as well? So I think there's a lot of room for that.
Totally. On prenatal care, I totally agree with you. There were definitely some visits where the only sort of physical thing that was being done during my prenatal visit was a blood pressure and a urine sample. Right. And I definitely think that with, especially now with COVID, people, you know, it wouldn't be so unreasonable to ask a family to just have a good blood pressure cuff at home.
Yes.
And you could probably, you know, use your FSA dollars to, your HSA dollars to pay for something like that and have a blood pressure cuff at home. Yeah. Even for my newborn, actually, we did a couple of the visits via telemedicine, and we actually just tracked his weight at home and had a televisit with a pediatrician.
Right.
And so I definitely think that there's definitely space in prenatal care to do those visits, but it needs to be sort of integrated with, you know, the doctor that you see in person. Right. Versus,
and the society, it can vary based on, you know, what each clinic is able to do, the size of the clinic, that sort of thing, for sure. What's nice is we do have some national guidance. So the Society of Maternal Fetal Medicine, they're the organization of high-risk OBGYNs. They put out a really nice paper just to serve as a template for here's how you would do this in the time of COVID, with the main focus on decreasing need to come in, infection risk, that sort of thing. But we can extrapolate that anytime. And so they talk about which visits, you know, are important, which ones we can potentially do at home. And a lot of it, like you said, prefaces that women who are pregnant at this time should have a blood pressure cuff at home, you know, should be able to weigh themselves, and potentially even have a little Doppler, which up until this point, I've always told women, I said, don't ever buy those because you're just going to listen and you're stress yourself out and there's no evidence that it decreases any outcomes. And now here I am, I'm like, you know, you should really get one of those things. Because if you can you check your fetal heart tones and, you know, the doctor's listening at the same time and you've got your blood pressure cuff and your blood pressure is normal, we don't even need a urine sample. So much of what we're doing is counseling and preparation and education. And maybe it will actually shift some of what we're doing more into the education space. So I think that's a great example of how, you know, I know when I was pregnant with my second, having to haul my then 4-year-old in, it was a pain in the butt. And I would have loved to have just called in and said, listen, I took my blood pressure, you know. But a lot of this, I think, is super important to think about just access to care.
Right.
You know, now when we're thinking about equitable care, we're thinking about maternal mortality, how it's higher for women of color in this country, especially Black women, when it comes to morbidity and mortality around pregnancy. Can we use telemedicine to reach these women to, you know, maybe they're not able to take off from work. Maybe they don't have a doctor they trust. Is there somebody that they can call in and they see somebody who looks like them or that they trust that they can connect with in a virtual space? I think that's a really exciting way that we could see telemedicine kind of integrating and reaching out to these women who might not have those resources.
Yeah, I like to think about sort of access in terms of economics, like can they afford it? Geography, is it, you know, reasonable for them to actually drive an hour or 2 hours for each visit? And I live in the DC area, and quite honestly, with traffic, I would drive an hour each way
Yeah.
to my
Yeah.
OB. And
Yep.
so like, if I actually lived in a place that wasn't even so accessible, I could imagine that, it might
Mhm.
be 90 minutes to your OB, which is really, it's a lot of time to
Yep.
do so frequently. And then the third way I like to think about it is sort of political access, right? Like, so
Mhm.
that's not really on the sort of pregnancy side, but if you're seeking
Mhm.
contraception,
Absolutely.
a lot of young women are like not able to seek contraception because of who they live with or what,
Mhm.
demographic they live around. And so I think that those three ways of access really give telemedicine a huge boost now, because it's more private, and
Yes.
in many
Yes.
ways it's more personal, because I know when
Yep.
I see patients via telemedicine, I'm looking at their face the whole time,
Mhm.
versus sometimes in the office I'm kind of
Yeah.
on my
Yeah. Mhm.
computer,
Exactly. Yeah.
trying to type as fast as I
Yeah.
possibly can.
Yeah.
And then, just a quick note about insurance, which you had mentioned earlier, which I
Mhm.
wanted to sort of touch on. The other issue, and I do agree with you, I hope insurance continues to reimburse telemedicine,
Mhm.
so that more people have access. A lot of people that use insurance go to their insurance website to find their
Mhm.
doctor, right? So
Mhm.
if insurance companies are not reimbursing telemedicine, they may not even list a doctor that
Mhm.
provides virtual care, because it's not going to come in
Right.
network.
Yeah.
And so it is really important that insurance companies continue to reimburse
Yes. Absolutely.
telemedicine. And that's really on the people to make sure that the voices are heard, to,
Yes.
unfortunately, as much as doctors would like to continue providing it,
Mhm.
um, the energy needs to come from the masses.
Yeah, no, it's so true. It's so true. And I agree. I think the contraception piece of telemedicine is like the most exciting to me, because that is at my core the idea that women should be able to make the choices that they want for their bodies, and it should not be dictated by the state that you live in,
Right.
or like you said, who you live with, and they won't take you to the doctor, or you're 17 and you don't have a license, and yet the closest clinic is 2 hours away. I think that telemedicine for contraception can be a great equalizer,
Right.
and can work in a way, some of these telemedicine places, okay, so now you've mailed out the birth control pill, and also now there's an app that can remind you to take it and when your refills are due, and can just take away a lot of the user error. And again, if we can have the iPhone 11 we're up to that can do some pretty amazing things, why can we not also use this technology to keep us healthier? So I think it's, not everything is appropriate on telemedicine, but for a lot of things, it can really be a game changer.
Yeah, no, totally agree with that. And so now that you've said that, I also
Mhm.
will draw on my own experience here. I had a high risk pregnancy.
Mhm.
And so I was actually going to maternal fetal medicine, getting those, my SD ratio checked,
Mhm.
and ultrasounds, and
Yeah.
some pretty heavy duty visits
Yeah.
leading up to my C-section. And so, obviously some of those visits could not be done
Right. Right.
by
Exactly.
telemedicine. So,
Yeah.
if you can just sort of touch on
Mhm.
what else do you think really should just not be done
Yeah.
by telemedicine?
And I think, yeah, I totally agree. And it's funny in this time of COVID, sometimes we're spending more time convincing people, no, you really do need to come in now, because
Yeah.
this, your blood pressure is at a dangerous level, or your baby's not, growing at a rate that I'm comfortable with, not having you come in and have an ultrasound. So for sure, sometimes, the computers are great, but not for everything. So when it comes to women's health, there are some things, I can't do a pap smear virtually. I would
Right.
love to, if you can invent that app, I'm all for it. So some basic screening, and we know, and we're seeing that women, I mean men too, but we're putting off maintenance care. So it is important that you're still getting your annual breast exam, that you're getting your pap smear when it's due, that if your IUD has expired a couple years ago, like, you should come on in. So there's just some things that we can't do. I also think that I wish I could do more. I've had people who've said, well, I've got this bump on my vulva, or I have this rash. And sometimes, it just doesn't translate well over, and it doesn't mean we can't have a virtual visit to chat about it. But if I determine, that's just that I would be giving you substandard care if I was trying to do this virtually, um, then you need to come in. Unless it's a perfect story for something, we might want you to come in and give a sample of something before we just call in antibiotics. And so it's just important to understand that if you do call in and your provider says, I can't handle that over the phone, it's not because we're trying to be annoying. We're trying to keep you out too in the time of pandemic, but even when it's not, there's just some things we cannot do, virtually. And just going back, one thing I just popped in my head that I didn't mention before, a lot of what we do, relation to women's health, mental health stuff, I think that's the biggest thing that I'm excited about telemedicine. So anything related to perinatal mood disorders or anything that has to do with anxiety, depression therapy, like why should somebody have to get in a car and drive to sit on their therapist's couch for an hour when they could do it here? And I'm not saying that personal connection isn't important, but think about how much more people might seek care if they could do it from the comfort of their own home. So that's another thing I think that is great too. So.
And be private about it, right? So I remember when I would go see my therapist, I was always sort of looking out in the waiting room, making sure that, I don't know. I mean, I'm not by any means ashamed that, I had a psychologist who helped me through some tough times in my life. But, I didn't want to really run into someone I knew
and the
in the waiting
stigma
room.
is there. And some people don't want to share that. And if you're in a small town where there's that one person that you talk to, and again, it should not be stigmatized, but you have the right to privacy. It's just the same in a small town if you're going to a certain clinic to get birth control, and now everybody knows your business. And so I do think that telemedicine can help put some of the confidentiality back in things in certain communities where it might be concerning.
Yeah, totally. And so talk to me a little bit also about confidentiality in the virtual world. Like what sort of things do we need to worry about or ask ourselves or ask our doctor?
Yeah. So it's important if you as a physician, you're providing telemedicine care, you're not just like at a coffee shop on your phone and you're Zooming with somebody or FaceTiming and you're like, yeah, I can fit this in. It's, that you're using a secure connection, and obviously your organization will have gone through all of that and you'll have the appropriate paperwork and all that good stuff. But I think it's important to realize that the confidentiality that applies in the office also applies here. And so I've had some teenagers who've asked me like, are you going to tell my mom that I'm on birth control? Are you going to tell my dad that I told you I was having sex? And I think it's really important to know that we are held to the same laws, which is that we don't disclose anything unless you're going to hurt yourself or somebody else, or, there's criminal activity. And if anybody has ever done that, maybe that's something that's been the most concerning about using social media is the number of messages I've gotten from teenage girls telling me, that isn't what happened. That my doctor did tell my mother this. Like, that's against the law. But when it comes to telemedicine, the same exact thing is there. And so if I'm at home doing a telemedicine session, I don't have my husband in the background, or I'm not out in my backyard where my neighbor could hear me. It's very much, we treat it with just the same respect that we do. This is our exam room and this is your space, and we're not going to record it and share it or anything like that.
Yeah, no, totally. I 100% agree. Again, I think that when I'm practicing telemedicine, and even I do a lot of education for doctors on telemedicine and what they should be doing. And, right now, in March, basically it was announced by CMS that we could use FaceTime and Facebook Messenger and these other ways to see patients virtually. And while that may, have been technically allowed, I always encourage doctors, just find a HIPAA secure platform and just send a secure link, because there's many out there. It's easy to use.
Absolutely. Yeah.
In an absolute scenario where for some reason, the site has crashed, or the link isn't working and things like that. Yes, you can definitely resort to FaceTime. I mean, the answer in that situation is not to not see the patient, but I definitely think that there's a lot of tools that are out there to establish these secure connections.
Yes.
So I definitely think that's a reasonable ask from
I totally agree.
from most people. And it's just, it just makes it also feel like a little bit more of a appropriate and proper visit rather than just doing FaceTime or whatever. But any final thoughts on telemedicine and anything else that you think, young women or any women of any age really should know about using virtual care in women's health, either something that you've seen that's wildly inappropriate use or something that's being underutilized?
Yeah, I think it's really important just to hit that message home that telemedicine is awesome, but it's not the cure-all. And that, we cannot, we want to be important and make sure we're not missing things. So if your doctor is saying, I need you to come in, or it sounds like this is a this is more than I can handle. We don't want you to put off care so much that then when you are finally seen, it's a bigger problem. So,
Yeah.
you are telling me you're having sex, but you don't want to come in to get tested. Can I just give you this antibiotic? And I say, no, that's not really ideal. Telemedicine can be great for so many things in that, if you're feeling embarrassed to talk about certain things in the office, it can feel a little bit, better here just because you're not having your mom drive you and wait in the waiting room. So
Right.
telemedicine for women's health can be certainly awesome. It can help fill in some gaps. It can help you get access to care if you're not able to, but do just know that some things are not appropriate. And I think we are not trying to make your life hard by having you come in. Sometimes you just need to have a pelvic exam. And I know it doesn't sound fun, but
Yeah.
to just ignore a problem for 3 years because it sounds uncomfortable, it could be a much bigger problem. And I think just vet your sources. Just like if you were picking a doctor, you wouldn't just Google and pick the first one that comes up, or maybe you would, but like you would want to make sure they seem legit, right? Like you would do more. And the same thing with the telemedicine service. They are not all created equal. And so I believe that you should look and make sure that they are legitimate, that they've got, people working there who are appropriately credentialed. And when it comes to using testing services, that you make sure that they are using labs that are approved by the FDA and that sort of thing. Because just look at how many people popped up, mail order COVID tests. And you're like, well, is that really legit or not? So just do your homework. And if you're not sure, reach out to your doctor or somebody and say, hey, can you help me? I'm trying to find this out. Now, are they legitimate or not? And you can usually figure out pretty quickly. Because it's pretty obvious.
Yeah, you definitely want to make sure there's a doctor behind the visit that you're seeing. I think
yes. You don't want it just to be, it's an emergency medicine person who's filling in, they're making money by calling in scripts for this. Like, do they actually have the training to be able to interpret your, or counsel you on your birth control needs, or, just to make sure that it's legitimate. Thankfully, I feel like that's more the case these days because, we do have the internet. We're able to compare and hold people accountable, but just be aware that not everything's created equal. Just like physicians and, clinics face-to-face, everything's different too. So.
Yeah, no, vet your sources and
Mm-hmm.
make sure you're doing your due diligence and research when
Mm-hmm.
you're picking a platform or picking a virtual doctor.
Mm-hmm.
And hopefully more and more doctors will be offering virtual services. So
Mm-hmm.
you may even be able to see your regular doctor virtually
Yes. Yeah.
as well, which is really nice. And I think actually what you mentioned is a great point for doctors as well. And I know that I definitely abide by this when I see patients virtually, is you have to have a low threshold as a physician to say, come
Mm-hmm.
into the office. And
Right.
I think that especially in a pandemic, we are really struggling with this decision
Mm-hmm.
because there is a risk to bringing someone into the office.
Right.
So I think that, for me, I really am very, very careful depending on what kind of patient, what's their
Mm-hmm.
risk demographic before I say, you know what, I don't think this is going to be working out virtually anymore. We
Right.
need to see you in the office. And I think it's important to keep that going even once this pandemic is over, to say,
Mm-hmm.
well, I don't think we've really appropriately addressed this. And we've tried a few things and they haven't
Right.
worked.
Right.
So it's time to take it to the next level.
Right.
And
You don't want to lower your standards just because it seems easier, or you think the patient will be more satisfied if you
right.
just go with it. We could that would be great. We'd have great reviews, but sometimes
Yeah.
you have to say, I thought this would be appropriate. It's not. And I think it's just important at the start of every visit that you just say, and keep in mind, if this comes up, we'll have to bring you in. And I
And
think most people get that because they want to feel that you're caring for them. They want to be taken care of.
And that can be tough for doctors. And I'm sure you feel the same way,
Mm-hmm.
that, you do worry about your online reviews. And
Mm-hmm.
sometimes, a patient's going to be upset when you tell them to come
Yes.
in, or you
Right.
tell them that, they need to be seen more frequently. But at the
Yeah.
end of the day, you just have to really stick with your gut and know
Yes.
that you got to
Yeah.
do what you have to do.
Yeah.
And
Yeah.
sometimes patients aren't going to be the happiest to
Yeah.
come in frequently.
Yeah, I think online reviews, that's a whole other ball of wax that we can
Yeah,
talk
that's a
about.
whole other,
But yeah, you
talk.
just always, you just have to do, what you ethically, we took an oath to not do any harm. And sometimes, um, it's doing the hard thing. But again, the majority of people want to feel cared for. And I don't know if you've seen this, but the people I've experienced who've been able to get this telemedicine, they're like, I am just so thankful that, we are in the midst of a pandemic and I'm still able to talk to my doctor. Like if this had happened 30 years ago, we would be in such a more difficult
Even,
place.
yeah,
So.
even maybe 15 years ago.
Yeah, no, I completely agree. Yeah.
Because I don't think like iPhone 1's camera was even close to what the cameras are now.
Oh no. And
And
between the healthcare issues and the homeschooling, like I don't know. I think the world would just be like, we'd be done. We'd just reboot and be done.
yeah, I mean, like the
So,
Spanish
yeah.
flu lasted 2 years. So
Yeah.
hopefully
No,
this
I can't
doesn't
handle
last.
that. Just one day at a time. That's all I can.
I know. Well, thank you so much for giving us all this great
Yeah.
information and talking to me about, as you know, one of my favorite topics,
Yeah.
telemedicine. But where can people find
Absolutely.
you online, your social media and website or anything like that?
Yeah. So I have a website, drjenniferlincoln.com, just drjenniferlincoln.com. And from there, or you can just go directly. I'm also on Instagram and TikTok. That's my
Yes,
new
you
fun
are a
thing.
huge TikTok star. Everyone needs to go watch her TikTok videos.
Did not want to join whatsoever. And now it's like,
Well,
like you said,
now you're like,
it's,
you've got
I
a
know
huge following. So good job.
yeah, it's all those, it's kind of like, I joke, it's like the telemedicine education standpoint or aspect of care. It's no direct medical advice, but it's, it's education just in a different way. But same thing, Dr. Jennifer Lincoln. And I think that's pretty much it. So, yeah.
That's both on Instagram and on TikTok.
Yes.
Dr.
And TikTok. Yeah.
And it's DR
Yeah.
for doctor.
Yes. Yeah.
Okay. All right, great. Thank you so much for being here and for, giving us your time, and really great discussion, and, hope to have many more with you.